See what happens.
Did you rush it, do you think?
Thank you.
Breaking right now, Republican leaders have abruptly pulled their health care overhaul bill from the House floor, short of votes and eager to avoid a defeat. Here's President Trump on what happened.
That the best thing we can do, politically speaking, is let Obamacare explode. It is exploding right now. It's many states have big problems. Almost all states have big problems. I was in Tennessee the other day, and they've lost half of their state in terms of an insurer. They have no insurer, and that's happening to many other places. I was in Kentucky the other day, and similar things are happening. So Obamacare is exploding with no Democrat support. We couldn't quite get there. We're just a very small number of votes short in terms of getting our bill passed. A lot of people don't realize how good our bill was because they were viewing phase one, but when you add phase two, which was mostly the signings of Secretary Price, who's behind me, and you add phase three, which I think we would have gotten, it became a great bill. Premiums would have gone down, and it would have been very stable, it would have been very strong. But that's okay. But we were very, very close, and again, I think what will happen is Obamacare, unfortunately, will explode. It's going to have a very bad year. Last year, you had over 100% increases in various places. In Arizona, I understand it's going up very rapidly again, like it did last year. Last year was 116%. Many places, 50, 60, 70%. I guess it averaged, whatever the average was, very, very high. And this year should be much worse for Obamacare. So what would be really good, with no Democrat support, if the Democrats, when it explodes, which it will soon, if they got together with us and got a real health care bill, I'd be totally open to it, and I think that's going to happen. I think the losers are Nancy Pelosi and Chuck Schumer, because now they own Obamacare. They own it, 100% own it. And this is not a Republican health care. This is not anything but a Democrat health care. And they have Obamacare for a little while longer until it ceases to exist, which it will at some point in the near future. And just remember, this is not our bill, this is their bill. Now, when they all become civilized and get together and try and work out a great health care bill for the people of this country, we're open to it. We're totally.
Well, wow. There is a lot to talk about and a lot to get to. Yeah. And we're joined now by the man who can explain a lot of this, UCF professor and political expert Jim Clark. Jim, there is so much happening at a rapid pace. What is going on right now?
Well, first, they pulled the vote because they didn't have the votes, and they didn't want to embarrass people by making them go on the record, either for or against. So they were trying to save some skins here in the Republican Party.
It's shocking, though, because it was no secret that there was a lot of people who didn't like this for a variety of reasons. You had, very conservative Republicans, more moderate Republicans, more liberal ones who didn't like various parts of that. And it seemed like almost the president wanted to play a little game of chicken by forcing this vote today. I mean, just yesterday, he said, we're going to have the vote and we're going to see what happens. And then, of course, the breaking news this afternoon, they pull it. So it's surprising to see all of these developments, I guess, because it shouldn't have been a surprise to anyone that the votes weren't there.
No, the opposition was building. First of all, this was always a Republican bill. Nobody reached out to the Democrats. Paul Ryan and Tom Price, the Health and Human Services Secretary, wrote this bill, and they
kept it secret, even from members of their own party.
Exactly. They locked out members of their own party to keep it secret, and then presented it as a fait accompli and told their members to vote for it.
Okay, so now who would you consider to be the big losers in all of this? Who's in trouble? Who's going to lose their job over this, possibly?
I think Paul Ryan has suffered a tremendous setback. The president put his faith in the speaker, and the speaker said, hey, I can deliver on this, and couldn't. The second one is the Health and Human Services Secretary, Tom Price, who was a major player in the House of Representatives before joining Trump's cabinet. He had his fingerprints on this bill, and it would not surprise me at all if Price is the first cabinet member to hear the famous words, you're fired.
You know, it's no secret that there are a lot of problems with Obamacare, and we heard House Speaker Paul Ryan kind of listing some of those in his press conference about 20 minutes ago. But is it a good move politically to let this thing explode, as the president suggested, or should they try and work in a bipartisan fashion to try and make some fixes to Obamacare? You know, what's your take on that?
That's what they've been unable to do. 8 years ago, the Democrats didn't work with the Republicans, and now the Republicans aren't working with the Democrats. There are, as you say, tremendous problems with Obamacare that were in there from the very beginning. As you'll recall, 8 years ago, the bill was rushed through. Remember some members saying they didn't even read it? And so instead of fixing these problems and making it work, they have not gotten together.
Right.
And so it'll be interesting to see if they can, as President Trump says, pull it together.
But if they let it explode, like he just said, and a lot of people start suffering and premiums go up, I mean, who is that going to fall on? He's trying to, it sounded like, pin it on Democrats, but are people going to hold him and Republicans responsible?
He's saying that people are suffering already.
Right. But, I mean, he's obviously it's projected to get worse.
The increases are not nearly as bad as he says they are. In a couple of places, they have been very high. But generally speaking, Obamacare has been rocky, but it's worked for most people. Now it's going to be interesting with government kind of indifference, whether it comes to a grinding halt, and somebody needs to replace it. The idea that we can somehow get along without it, there are hospitals like Florida Hospital, Orlando Medical Center that depend on that money from Obamacare.
All the Medicaid and Medicare dollars.
It's going to really hurt badly millions of people, but also hospitals around this country and doctors if they don't come up with some compromise.
Well, we are getting the rap right now from our producer.
The really hard rap. It's always nice to have you to explain
you.
things. Thank you very much. We'll see you later to break down what happens if anything happens later.
Yeah,
exactly.
Thank you.
Thank you, Jim.